Good morning. How are you all today? We are going to go through the demonstration of doing an intramuscular injection. Alright, and we have our patient here. Then we go and meet my patient, Mr. Mohammed Said Hamid. Good morning, Mr. Mohammed. How are you today? My name is Hema Roslin and I am the nurse assigned to take care of you. Hope you had a good rest last night. May I check your ID band, please? Okay, Mr. Mohammed Said Hamid, yes. And the number is 46225. Yes, you're my right patient. Thank you, Mr. Mohammed. All right. You have been prescribed an injection and it is to prevent allergic reactions. Because you're receiving chemotherapy, we do not want the chemotherapy drugs to cause an allergic reaction in you, and hence an antihistamine or an injection is prescribed to prevent allergic reactions. Alright, I think you received the same yesterday as well. Where did you receive it? Okay, you received it on the left buttocks. Okay, so today is it okay for us to give you on the right side? Yes, he's okay with that. Well, you're my right patient. I'll get my equipment and I'll come back to you. And as in case of any other procedure, you will have to provide privacy to the patient, which we are not doing now because of demonstration purposes, but it is part of the procedure that we provide privacy. Now let me come back to my equipment. I've got my equipment ready. I've got my medications, I've got my syringe, I've got the needle to administer, I've got my cotton ball, I've got the gauze to break the ampule, I have the alcohol swab, and I also have a band-aid, along with which I have my gloves and the sharps container. Well, I'm looking at my medication order. The medication order, yes, Mohammed Said Hamid, 46225, and injection chlorpheniramine maleate 10 milligrams 1 ml has been prescribed for him, and the route of administration is intramuscular and stack, meaning we need to give it right away. So that is the drug. So let me take my drug out. So I do have my drug. My first check, injection chlorpheniramine maleate 10 milligrams 1 ml, and the date of manufacture is 12/2019 and the date of expiry is 12/2024. So this is my right drug. Now I also need to do a second check. I will be doing the second check with my colleague, Mr. Khalid. Good morning, Mr. Khalid. How are you?
Yes,
this is
good.
my drug for Mr. Mohammed Said Hamid. It's injection chlorpheniramine maleate 10 milligrams 1 ml, and the expiry date is 12/2024. So it is not expired. So can I administer that?
Yep.
Yes, thank you. So that's my right drug. And I also, as part of my pre-assessment, I need to look at some of the lab values of the patient. Because the patient is getting chemotherapy, there could be an hematopoietic or bone marrow depression, and so he could be having low platelet count, and hence I want to check my CBC reports. So this morning we have received the CBC reports. The patient's platelet volume and the platelet count is normal. His coagulation profile is also normal, and hence I can safely administer this medication through the intramuscular route. Alright, so now let us go on to prepare the medications. And yes, so let me start off. So I'm using my hand rub. Do not forget your hand rub as part of your infection control procedure. And also because these patients, they will also be having an altered immunity status, and so we should be cautious that we do not pass on any infection to the patient. So I have done both my checks of the medication. My third check, I'll be doing it just prior to the administration of the medication. Well, so this is my drug. I ensure that I tap the ampule neck so that all the medication gets into the chamber completely, so that I get my right dose, all right? So I have my medication there, and I'm looking at the syringe. It's not expired. I'm also looking at my needle. It is also not expired. So now I can break the ampule. I have ensured that all the medications are down into the main chamber. So I hold it away from me and break the ampule and discard the neck right into the sharps container. All right, I have my syringe in here. Okay, I'm going to aspirate the syringe, the medication. I need not aspirate and push air into it because it's not a vial and there is no pressure in there. So I go down and I aspirate the medication. Alright, so I have aspirated my medication. Okay, and I tap it to remove all the air bubbles, and as I'm doing that, I should ensure that I do not touch the plunger, because touching the plunger would be unsterile and unsafe as well, and hence I do not touch the plunger. So I'm looking at my medication and trying to expel all the extra air that is there. So I fold this, and okay, so with that I've got the right medication and the right amount. So I will remove my needle and put it into the sharps container, and I can take my needle which I'm going to administer with and fix it into the syringe. Okay, my third check, again I will be doing my third check, injection chlorpheniramine maleate. All right, 10 milligrams, 10 milligrams, 1 ml, 1 ml, and expiry date is 12/20/24. So I am now ready. I can take my medication trolley across and yes, administer the medication. So again I do a hand rub because I have touched the articles that are required, and let me take my trolley across and prepare the patients now. Hello Mr. Mohammed, how are you? Can we administer the medication for you? Since you said you want it on the right gluteus, can you turn a little bit? Can I help you with that? Yes. Okay. All right. Yes. Thank you. Are you comfortable? Yes, you are comfortable. Okay. So fine. And let us start off. So, Mr. Mohammed, what did you have for breakfast this morning? Did you like your breakfast? The reason why we keep talking to the patient is one is for diversional therapy, and also for muscle relaxation, because when you're going to break the patient out of here, can hold his muscles tight and the pain could be greater, and hence you keep talking to the patient to divert his attention, or the other thing you can tell them is to take deep breaths so that they're concentrating on that and the muscles also relax, and it's easier for you to administer and reduces pain for the patient as well. So I have done my third check, so let us go across. I've got my alcohol swabs. Okay. Alright. So now we need to identify the landmarks. So the heel of your palm should be on the trochanter. Alright, the heel of the palm of your non-dominant hand. The heel of your palm should be on the trochanter, and your index finger should be on the anterior superior iliac spine, and your thumb should be facing towards the abdomen of the patient, and the middle finger should be touching the anterior superior iliac crest. Okay, so the palm heel should be on the trochanter, the index finger should be on the anterior superior iliac spine, and the middle finger on the iliac crest. So you form a V over there. Okay, so you form an imaginary V and you clean that area. So you go from the center to the periphery. All right, so once that is done, you've got your medication. All right, and you also have your cotton ball with you. Okay, so you can remove your needle there. All right, and your Z track is important so that you stretch the skin across. All right, and you go down. You go down at 90 degrees. All right, go down at 90. Hold the hub of the needle. Please hold the hub of the needle and aspirate. When you are aspirating, look for any blood. If there is blood, kindly discard the whole unit and prepare all over again. If there is no blood, you're safe to inject. So yes, Mr. Mohammed, there's a small break. Shall we go ahead? Yes, yes. Okay, it's almost done. It's almost done. Yes. So I leave the syringe there for a few seconds, about 10 seconds, and then I remove it. Then I apply a cotton swab there and discard my syringe directly into the sharps container. All right. And then I also need to apply a band-aid. There is no need for you to massage the area. Okay, so please do not massage the area. Just look and see if there is any bleeding over there. All right, and then you can apply this right away. So Mr. Mohammed, we are done with the medication. All right, I hope it was not very painful for you. All right, so let me put the patient back into a comfortable position. And now I need to educate him about the side effects of this medication. Well, Mr. Mohammed, this medication can cause you a small amount of drowsiness, and so we will put your bed at the lowest position. We'll put your bed at the lowest position so that there are no chances of fall. And yes, that's in the lowest position. And we already have the side rails up, but it's important if the side rails are down that you pull the side rails up. And we also give the call bell. Your call bell is here. If you need any help, please ring the bell. Please don't get out of your bed without any assistance. All right. So this medication can cause a certain amount of drowsiness, and in case you have any breathing difficulty or anything abnormal that you feel, kindly let us know. So I've put my patient back in his normal position. I'm coming back and I discard all that is not required. And all right, remove my gloves. All right, then use a hand rub. And then go on to do my documentation. So in my documentation, injection chlorpheniramine maleate, 10 milligrams, 1 mg, given on the right ventrogluteal site. Given on the right ventrogluteal site at 11:50 a.m. So I have administered my medication. The patient tolerated the medication. There were no side effects, and the patient is comfortable. Thank you.